In this video, we will continue to look at the nerves of the upper limb. And the case is a 45-year-old female who sustains an injury to the elbow after a fall, and as you can see from the x-ray, she has a dislocation of the elbow. As usual, pause the video and see if you can figure out what nerve might be affected, what the clinical features might be, and as much of the anatomy of the nerve as you can remember. Yep, so this is the ulnar nerve. The ulnar nerve arises from the lower roots of the brachial plexus, C8, T1, and it is a terminal branch of the lateral cord of the brachial plexus. It runs just posterior to the brachial artery in the upper arm, but about halfway down the arm, it runs posteriorly, pierces the medial intermuscular septum, and then runs the rest of the course in the arm in the posterior compartment of the arm. It then winds its way around the medial epicondyle in the medial epicondylar groove through the cubital tunnel and enters the forearm between the heads of flexor carpi ulnaris. It then runs just deep to flexor carpi ulnaris on its radial border and just between flexor digitorum profunda and superficialis. It emerges from behind flexor carpi ulnaris at the wrist, crosses the wrist superficial to the flexor retinaculum, but through a small tunnel called the medial, I think it's the ulnar ulnar retinacular tunnel. I'm not sure, you need to check that name for me. And supplies both motor and sensory function to the muscles and skin of the hand. In the forearm, it gives off a dorsal branch which supplies the dorsal 1.5 fingers on the ulnar side, so that's the little finger and part of the ring finger. And it also supplies the muscles of the hypothenar eminence and the small muscles of the hand. So here's a list of muscles that the ulnar nerve supplies. Notice it doesn't supply all the lumbricals. And its sensory function is to the medial part of the hand, both the dorsal and palmar aspects. So therefore, an injury to the ulnar nerve will cause numbness over the little finger and weakness of adduction of the fingers. The typical claw hand that we learn about is not usually an acute presentation of ulnar nerve injury, but develops with time. Typical injuries that may cause damage to the ulnar nerve include injuries at the elbow, for example, dislocations and some fractures, and also wrist injuries such as lacerations. The nerve can also be entrapped at the wrist or at the cubital tunnel at the elbow. As usual, if you have any questions, you can bring them up in class. We have one more nerve to look at in the next lecture. Once more, thank you for listening.